Lawsuits across the country are popping up over mask mandates in schools. Infectious disease scientist Dr. Marjorie Smelkinson wrote an article in The Atlantic with other doctors to make the case against masking in schools. And she wrote, many countries, the UK, Sweden, Norway, Denmark, and others have not taken the U.S.'s approach and instead follow World Health Organization guidelines, which recommend against masking children ages 5 and younger because this age group is at low risk of illness, because masks are not, quote, in the overall interest of the child, and because many children are unable to wear masks properly. Even for children ages 6 to 11, the WHO does not routinely recommend masks because of the potential impact of wearing a mask or on learning and psychosocial development. The WHO also explicitly counsels against masking children during physical activities, including running and jumping at the playground, so as not to compromise breathing. Well, Dr. Marjorie Smelkinson joins us this morning. Welcome to the National Desk. We appreciate you joining us.
Thank you for having me.
I have a first grader who has never been to school without a mask. I'm just curious, how do you think that's going to affect her in the future? And when you take a look at all the data, how does the U.S. compare to these other countries that opt out of masking in schools?
Yeah, so the WHO does not generally recommend masking kids under 12 because it can be a health risk and can have major impacts on learning. In contrast, the CDC is much stricter, recommending masking of all students, staff, and visitors to school ages 2 and up. So this makes America, compared to the rest of the world, a significant outlier in the extent that we mask our children. And despite this, the US has had more COVID deaths per capita compared to other rich countries that have had less student masking. Of course, there's other confounders here. For example, the US has higher rates of obesity and heart disease, which does raise the risk of COVID. But nevertheless, even making comparisons within the US, we do not see big differences in cases between states with and without school mask mandates.
So if the data shows masking in schools does not drastically protect children the way it was intended, then why do you think masks are still being implemented here in the States?
Well, unfortunately, too many pandemic policies have been guided by politics and not by science. So politics have played so heavily into our policies that there's been a lot of lost trust amongst the public. And I see this especially in frustrated parents who just don't see an end to these mitigations in their schools. Because even those in the bluest of bubbles can see that schools in neighboring states are largely back to normal. They can read that nearly half of districts in the country don't currently have mask mandates. So, you don't have to be a doctor or a scientist to see that many of these strict school policies are really unnecessary. And our public health officials must start making evidence-based decisions if they want to regain that public trust.
And I'm curious, is this a consensus among more infectious disease experts about masking children? Is there a consensus things have gone too far?
So there is a growing consensus shared by even many staunch mask advocates that it is time to make masking in school optional. Kids were always at very low risk for severe disease, and now that children have had 3 months, children 5 to 11 have had 3 months to get vaccinated, their risk can now even be lower. And at this point, any benefits that masking may have in schools must be weighed against the potential harms. And, there is evidence that masking can impede speech recognition, they can decrease the ability to decode facial expressions, and they can just make communicating harder. There's also anecdotal evidence that masks are increasing referrals to speech pathologists and are having impacts on social emotional skills. So these costs are reason enough to eliminate school mask mandates if they're just not backed up by robust data.
Yeah, and as an infectious disease scientist, you were calling for public health officials to reconsider masks in schools. So what's your message to public health leaders and school districts pushing for masks to remain in schools?
So Omicron has clearly established that this virus is here to stay and will continue to circulate much like the flu. These zero COVID policies just don't work, and it's time for more permanent solutions for living with this virus. Eliminating unnecessary mitigation measures does require looking hard at the data behind each mitigation and weighing the benefits against the harms. And masking at school is simply not backed by strong enough data and should be made optional. And instead, we should really be focusing our priorities on what we know works against COVID, and which fortunately also works against other pathogens as well. So for example, ensuring that schools have proper ventilation and encouraging more outdoor time, since we know that outdoor transmission is exceedingly low. Also encouraging teachers and children to stay home when they're sick and supplying rapid tests to anyone that wants them. Also, just focusing on the overall health of students and in general, teaching about proper diet and encouraging exercise. As we know, obesity is a major risk factor for COVID and other diseases. So if we focus on what works and eliminate what is not backed by data, then school life can largely return to normal.
All right, Dr. Marjorie Smalkinson, we appreciate you joining us this morning with some great insight there. Have a great weekend.
Thanks so much.